Hi, this is Lisa. I'm the nurse going off shift, and I'm going to be giving you a report on your four patients. The four patients are Lawrence Bland, Talita Brown, Albert Dactone, and Helen Green. I'm going to start with Lawrence. Lawrence is a 71-year-old patient. He was admitted today from a long-term care facility for evaluation and care of an infection on his lower right extremity. Um, it did test positive for MRSA, and he has a history of Parkinson's disease. So I'm going to go ahead and launch his chart here. So we're going to start with the overview. Sorry, it just takes a little bit. So Lawrence Bland, that's Lawrence right there. Lawrence is 71 years old. He is allergic to um, cavoloic acid, seafood, amoxicillin, and oh my goodness, and seafood. He is also, like I said, he is on contact precautions and he is a fall risk and he's a full code. So he was admitted today or yesterday. Um, you can see he's got some problems. He is hard of hearing. He also has a history of dementia and Parkinson's disease, but he's been alert and oriented for me. His vital signs you can see are 98.1, pulse 52, respirations 20, blood pressure 122 over 99 or 72, and his pulse ox is 99. Lab work, glucose is 116, it's just barely high. His BUN is high, creatinine's normal, sodium is on the high side of normal. His K is 3.1, and he's been getting some replacements. I'll let you look at the rest of the labs. Um, his orders, he's on contact precautions, and let's go here. Contact precautions, and he has some medication, which I'll review. He also needs vitals every 4. O2 is needed to keep his SATs up, and blood and wound cultures. Medications, you can see he's got a lot of medications. He's on amiodarone, carbidopa, docosate, gabapentin, levothyroxine, memetine, potassium chloride, 10 milliequivalents. He needs to get that for his K. Rivaroxaban, and then he has Tylenol as needed for pain and Lexapro as directed. Those are his meds. He, like I said, he has an infection wound on his right lower extremity. He does have some purulent drainage to that. And he does, like I said, have the history of Parkinson's. So sometimes he has some trouble talking and with, not talking, but with trembling. So he might need assistance, but he is alert and oriented. So next we're going to go to our next patient, which is Talita. Talita is 64 years old. She has bacterial meningitis and I want to say pneumonia. Um, she before she was admitted, she has been disoriented and confused. It's gotten worse since she's been here at the hospital. She can answer her name, but she will not answer questions correctly. She is agitated and does not follow commands. So she has some allergies to sulfonides, minocycline, iodine contrast media, codeine, and lisinopril. These are all her allergies. She is a non-insulin diabetes, and she does have a history of hypertension. Temperature was elevated on admission. It was 103 yesterday. It's come down, and I will get that for you. You can see the rest of her vitals here. You can review her lab work. I will let you review that. She has orders for a mechanical soft diet because she does have trouble chewing and swallowing. She's on vancomycin, which is due now, dexamethasone, I can never say this, meropenem, and she does have a Tylenol suppository. And she has some notes and different things like that. As I said, she is being treated with IV vancomycin, which is due now, and her temperature is 101 degrees Fahrenheit. But she does need to get her vancomycin to help with that meningitis. Our next patient is going to be, sorry, it takes me a minute to go in between cases. Albert Dactone. Albert is, we are going to launch his session here. Albert is 59 years old. He was admitted with a 24-hour history of severe abdominal pain with nausea and vomiting. He went for a stat CT, and that showed multiple adhesions, gut ischemia, and a complete bowel obstruction. He is going to be going in the next 30 minutes for an emergency abdominal laparoscopy. They're going to get some of those adhesions out and perform a small bowel resection. So he has no known allergies. He came in with the stomach pain, nausea. He does have a history of chronic constipation, hypertension, and migraine headaches. And he is on medications to treat those 3 complications. You can see his vital signs. Temperature is 37.1, pulse 89, respiration 20, 130 over 85, and 98%. He is rating his pain an 8. You can review his lab work. He had a surgery consult. He had the CT of the abdomen is done. He is NPO for the surgery, and he does have some medications that are on call. That is the Cefazolin, 1,000 milligrams. That's to be infused now because they have called for him. And then you can see his other 3 medications, his enalapril, linaclotide, and I can never say this one, I'm sorry, sumatriptan. But those are all due also. His consent form is signed and he's ready to go. We just need to give him that Cefazolin and any medications that he's due for. Our last patient is Helen Green. Helen is, let me find her here. Helen is a 51-year-old patient. She was diagnosed with asthma 2 weeks ago. Her doctor started her on Advair and albuterol MDI, meter dose inhaler, at home. She's been using that without having any problems, but recently her husband and her have bought an old farmhouse. It's like over 100 years old, and they've been renovating it. And she realized after working with the renovations that she was having trouble breathing. She started coughing, having shortness of breath, could not catch her breath. She was taking her albuterol inhaler as directed, and contacted her doctor, and he brought her into the hospital to treat her for her asthma. You can see she was admitted. She has allergies, a lot of food allergies, and they're wondering if her allergies are maybe also help contributing to her asthma. She has allergies to peanuts, strawberry, mold, and cats, and she is a full code. Her problems: shortness of breath, wheezing, newly diagnosed asthma, menopausal. Vital signs: her temperature's afebrile. The rest of her vital signs look good. They did some ABGs. You can see she's SATI 94%. And that looks good. So we have orders for vital signs every 2 hours and PRN with continuous pulse ox, and then every 4 hours and PRN after that. Oh, excuse me, every 2 hours times 8 hours, and then every 4. She's had her spirometry testing, and she has orders. I'm going to go to her meds for some inhaler medication, the Xopenex and the albuterol. She can have albuterol as a nebulizer or an inhaler, depending on how severe her asthma is, her symptoms. She gets a Xopenex every 4 hours. Lorazepam is PRN. Famotidine is what she's got due now is her famotidine, her Advair, and her Xopenex. And she is complaining that she's feeling really short of breath and starting to be wheezy again. So she needs to have her albuterol. And she's also requesting something for anxiety. So these are your 4 patients. And you will need to evaluate which ones you would see in what order and administer their medication. Thank you, and I hope you have a good evening.